Hello guys, my name is Shkil Hassan. I am from International Medical University. I am a second year student. Today my topic of presentation is drug affecting on osteoporosis. What is osteoporosis? Osteoporosis is basically a bone disease. In this, bone is weakened due to lower estrogen levels. What is estrogen? Estrogen is used to maintain and build your body, body and bones. How we can find osteoporosis? When we have a back posture, when we have back pain and loss of height. These are the main symptoms, and let's discuss about the slides. And here is a drug affecting on osteoporosis. Bone is mineralized connective tissue that exhibit four types of cell: osteoblast, bone lining cell, osteocyte, and osteoclast. Bone exert important function in the body such as locomotion, support, and production of soft tissue, calcium and phosphate storage, harboring a bone marrow. Bones are mostly made up of protein collagen which forms soft framework. The mineral calcium phosphate harden this framework, giving it to strength. More than 99% of our body calcium is held our bones and teeth. Osteoporosis is a health condition that weaken bones, making them fragile and more likely to break. It develops slowly over several years and is often only diagnosed when a fall or sudden impact causes a bone to break fracture. The most common injuries in people with osteoporosis are broken wrist, broken hip, broken spinal bones, vertebrae. However, breaks can also happen in other bones such as in the arm or pelvis. Sometimes a cough or sneeze can cause a broken ribs or the partial collapse of one of the bones of the spine. Osteoporosis is not usually painful until a bone is broken, but a broken bone in the spine are the common cause of long-term pain. Although a broken bone is often the first sign of osteoporosis, some older develop the characteristic stooped posture. It happens when the bone in the spine have broken, make it difficult to support the weight of the body. Losing bone is a normal part of aging, but some people lose bone much faster than the normal. This can lead to osteoporosis and an increased risk of broken bones. Women are also lose more rapidly in the first few years after the menopause. Women are the more at risk of osteoporosis than men, particularly if the menopause began early at 45 or they had their ovaries removed. However, osteoporosis can also affect men, younger women, and children. Many other factors can also increase the risk of developing osteoporosis, including taking high-dose steroid tablet for more than 3 months. Other medical conditions such as inflammatory condition, hormone-related condition, or malabsorption problem. A family history of osteoporosis, particularly a hip fracture in a parent. Long-term use of certain medicine that can affect bone strength or hormonal levels, such as anti-estrogen tablet that many women take after breast cancer. Having an eating disorder such as anorexia or bulimia, having a low body mass index, which is also called BMI, and not exercising regularly. Many diseases and disorders have been associated with osteoporosis. For some, the underlying mechanism influencing the bone metabolism is straightforward, whereas for others, that cause are multiple or unknown. Hypogonadal state that can cause candy osteoporosis, women estrogen deficiency, men testosterone deficiency, endocrine disorder that can induce bone loss include Cushing syndrome, hyperparathyroidism, hypothyroidism, diabetes mellitus type 1 and 2, malnutrition, parental nutrition, and malabsorption. People with rheumatological disorders such as rheumatoid arthritis, systematic lupus, or polyarticular juvenile idiopathic arthritis, chronic kidney disease can lead to renal osteodystrophy, hematological dystrophy, and several inherited disorders. Osteoporosis occurs when bone lose minerals such as calcium more quickly than the body can replace them, leading to a loss of bone thickness, bone mass, or density, which is called BMI. As a result, the bone becomes thinner, less dense, so that even a minor bump or accident can cause serious fractures. These are known as fragility or minimal trauma fracture. 2/3 of fracture of the spine are not identified or treated, even though they are nearly all cause pain and some disability. Osteoporosis can easily be diagnosed on a special type of X-ray known as DEXA scan. This machine determines the bone mineral density (BMD), and DEXA use a very small dose of radiation to produce picture of inside of the body to measure the bone mineral density or bone mass. And the class drugs affecting on osteoporosis first is biophosphonates. In this, clodoronate, alendronate, in this Bonosto and Fosamax. benodronate, which is Bonavia, and zoledronic acid, which is Risalid and Zumeta. Second one is monoclonal antibody medication, in this denosumab, which is Prolia and Jiva, and romosumab, which is Evanti. Third one is hormone related therapy, which is raloxifene, which is Evista, estrogen replacement therapy. Another one is testosterone, which is testosterone replacement therapy. Fourth is parathyroid hormone, which is teriparatide fortio, and a beloparatide, which is timolus. Fifth one is calcitonin, which is myocalcin, and sixth one is calcium and vitamin D supplements. Biophosphonates is first generation MCT. In this madronate, clodronate, atidronate, and tyludronate. In second generation is alendronate and pamidronate contain a nitrogen group in the side chain value 10 to 100 times more potent than first generation compound. And in third generation, the residronate and zoledronate contain a nitrogen atom with the hydrolytic ring and are up to 10,000 times more potent than the first generation agents. Monoclonal antibody medication. Prolia is an anti-reabsorptive rank lesion inhibitor, and its mechanism of an essential mediator of osteoclast activity. Increased rank lesion by led to increased bone loss. Its function and survival treatment of postmenopausal women with osteoporosis that had high risk for fracture. Treatment to increase bone mass in men with osteoporosis. Treatment of glucocorticoid-induced osteoporosis. Treatment of bone loss in men receiving androgen deprivation therapy for prostate cancer. Treatment of bone loss in women receiving adjuvant aromatase inhibitor therapy for breast cancer. An injection given by healthcare provider to savage. Estrogen replacement therapy is the mechanism of action of raloxifene occur through the binding to estrogen receptor. These binding result in activation of estrogenic pathways. Estrogen antagonistic effect and blockade estrogen antagonistic effect in tissue that express estrogen receptor. The recommended dose for osteoporosis is 60 mg orally each day. Most common documented adverse effect of raloxifene are hot flashes, flu-like symptom, muscle spasm, arthroglera. Less common effect are insomnia, vomiting, synesthesia, deep venous thrombosis. Testosterone replacement therapy. In some studies, osteoporotic men undergoing TRT have been shown to have increased bone density through BMD does not reach normal male level. And the testosterone to estradiol, which allow action via binding. Its side effects are irritation, redness, pain, tenderness, swallowing, toughing, blood staining, stinging or swelling of lips, unpleasant or bitter taste of mouth, difficulty tasting food, headache, acne, breast pain or enlargement, and it taken one capsule a day. Class by bisphosphonate drug is alendronate. Dosing it daily or weekly tablet or weekly effervescent tablet that should dissolve in water. It works to strengthen bone by slowing the rate at which osteoclast remove bone. Side effects of gastrointestinal problems such as trouble swallowing, inflammation of the esophagus, and in the jaw rare. Second one is Bonavia. Its monthly tablets injection every 3 months. It works to strengthen the bone by slowing the rate at which the osteoclast remove bone. And its side effect, the fracture of thigh bone with more than 5 years of use. Forteo is a prescription medicine used to treat postmenopausal women who have osteoporosis, who are at high risk for having broken bone fracture or which cannot use osteoporosis treatment. Each cartridge pre-assembled into delivery device delivered 2 mcg of teriparatide per dose each day for up to 28 days. Teripeptide is a potent anabolic agent used to treatment of osteoporosis. Its common side effects are nausea, joint itches, and pain. Abaloparatide brand name Timolus. It's 80 mcg to 40 mcl pre-filled pen delivered 30 daily doses of 80 mcg. Calcitonin nasal spray is used together with calcium and vitamin D to treat bone loss in the women with postmenopausal osteoporosis who have postmenopausal for at least 5 years. For postmenopausal osteoporosis, the 200 international units are one spray into one nostril per day. Calcitonin is a hormone that is produced in human by the perifollicular cell or thyroid gland. Calcitonin is involved in helping to regulate the level of calcium and phosphate in the blood, opposing the action of parathyroid hormone. This means that it acts to reduce calcium level in the blood. However, the importance of this role in human is unnuclear, as the patient who have very low or very high level of calcitonin show very adverse effect. Calcium D3 nicomide 4 regulate calcium and phosphorus metabolism in the body, bone, teeth, nails, hair, muscle. Decreases reabsorption and increase bone density, filling in the lack of calcium and vitamin in the bone is required for mineralization of teeth. 1.2 times a day for treatment and prevention of osteoporosis. First one is zoledronic acid 4 mg to 5 ml. It taken as 5 ml once a year. And another one is Prolia 6 mg to 1 ml. It taken as 1 ml twice a year. Another one is Evista 6 mg tablet taken as 1 tablet a day. Another one is Fortio, which is 20 mcg to 2.4 milliliter pen. It taken as 1 dose 20 mcg a day. Another one is calcitonin solument 3.7 milliliter. It is a nasal spray, one spray into a 1 nostril a day. Calcium D3 nicomate tablet, it taken as 1 pill 2 times a day. Thank you for your attention.